Jane Morgan, Executive Director of the COVID Task Force at Piedmont Healthcare, joins us now live from Portland, Oregon, to discuss these surges, also what you should be doing right now to stay safe. So, Dr. Morgan, it is great to see you. Thanks so much for joining us.
Thanks for having me, Alex.
All right, so you just heard Alex say, and I'm Veronica, by the way, but you just heard Alex, that's okay. You just heard her say that Rocky Mountain states, the upper Midwest, those COVID cases there are all surging, and I believe numbers are up across 20 states right now. So what's behind this?
So I think we see in the UK specifically that adolescents are driving these surges in cases, as we see our older population, older than 65 or 70, by and large have a greatly decreased rate of infection. In the United States, as we have started to drop our mask mandates, and we have really exhibited COVID fatigue and have started to have large gatherings and football arenas and sporting events and parties and concerts, and have been very somewhat cavalier and feeling comfortable that we have gotten over this Delta surge. I think that what we are seeing is that we certainly have not gotten over this Delta surge, and we must remain vigilant.
Well, I wanted to get your opinion on that, because I think that people get really confused. They hear the guidance of, okay, those numbers are now down and you can take your mask off, you can congregate in person. Do you think the CDC or leadership in general has been reactive or proactive in their approach to handling the pandemic? And I mean, what would your guidance be in this case?
So I think what we have seen from the CDC is their consistency in following science. And when we have mask mandates or not have mask mandates, public health measures still should be followed, including social distancing, making certain that your hands are cleaned, and above all else, getting vaccinated. And so we want to reach this herd immunity. And as long as we still haven't reached that level, we continue to be at risk of this virus circulating. And so even though mask mandates were dropped, and in some cases probably dropped prematurely, you still have to make certain that you are prudent and you exercise cautions and situational behaviors depending on where you are. Certainly, you may not need masks in certain situations if you're around vaccinated people or if you are outdoors. But if you're moving indoors or you are moving into mixed environments, then you may want to consider whether or not you need a mask.
All right, so you do think that some of those mask mandates were dropped prematurely. In the meantime, let's talk about booster shots, doctor, because California, Colorado, New Mexico, they have been allowing every adult to receive a booster shot, and that goes against federal recommendations. So why do you think those states have decided to make this move?
I think we're going to see that the CDC will eventually come out and state that as they continue to look at the data. And this is probably the right course. One of the things that we want to think about as we are a global society is we have so many countries that still have not gotten access to their first dose, the majority of the population. I think when we look at the United States, however, if we cannot get these boosters out, we will find ourselves regressing. And so we have to continue to protect the population, because we know that people who have gotten their vaccinations more than 6 months out are having decreasing immunity. Their immunity is waning, and that therefore puts them at risk of breakthrough infections, which then puts society at risk of greater spread. So we must continue to move forward with these boosters, protect those who've already been immunized, and encourage those who have not been immunized to step up and get vaccinated.
All right, you just mentioned the vaccines waning there. I want to get your take on this. Do you think we're going to need a fourth shot in this instance?
So this will entirely be directed by our behavior. And this entire pandemic certainly has been driven by behavior. You probably don't remember, but at the beginning of the pandemic, we simply were going to shelter in place and allow this virus to pass for 60 or 90 days. And so behavior, time and time again, all the way through the fourth surge, has determined the longevity of this virus. And so I can certainly foresee that we may need a fourth shot as we continue to fight this virus and more mutations and variants develop that continue to put our vaccines under challenge. And that's what we want to dampen. Even if this pandemic moves to an endemic state, meaning it's at a low level and we learn to live with it. That means that it is still alive and still has the opportunity and the propensity to change and develop mutations that can put humans at risk. And so we must continue to remain vigilant, encourage vaccinations, and encourage people to be prudent in all of their social interactions.
So much great advice. All right. Dr. Jane Morgan, it is always good to see you. Thank you so much for joining us here on Morning Rush.
Thanks, Veronica.